Hello everyone, my name is Megan Kloft, and I will be presenting research on the serious health issue of sexual assault in college students. This health topic is prominent and rising, so let's begin. The goals of this presentation for you all are as follows: to increase knowledge of sexual assault in college students, influence attitudes towards sexual assault in college students as an important health issue, to identify implications sexual assault on college students has on public health, and also to introduce recommendations for public health regarding this health issue. We will cover all of these goals as we move through the presentation. Before we proceed, I would like to recognize the methods used in conducting research on the health topic. I utilized many scholarly research journals from the University of Florida Smathers Library, credible news sources such as Wall Street Journal, an expert speaker, Professor Sharon Potter, and government internet regulated sources such as the Centers for Disease Control. These research methods brought together supporting evidence concerning sexual assault in college students. Sexual assault in college students is generally defined as the sexual contact or behavior exhibited upon a person without receiving consent from the victim. It has grown in concern as more and more college students are experiencing sexual assault at least once while in school. It is known that those in their first year of college or that steer away from heterosexuality are at a higher risk of experiencing a sexual assault within the duration of their studies. It has also been found that nearly 1 in 5 women in college experience a sexual assault. Sexual assault can happen to anyone and can occur often in instances involving physically forced coercion or convincing someone to the assault to happen, and the influence of drug and alcoholic effects. Though these instances of occurrence are not always the case, one must be aware that these are recognized as commonly identified pathways for sexual assault to occur as reported by victims. Some other notable statistics to pay mind to are as follows. 1 in 6 freshman women are assaulted nationally among colleges. That is a large amount of women assaulted when nearly 57% of college students in the United States are women. For a close example from the University of Florida yearly surveying system, it was found that 30.1% of female undergraduate women experience a non-consensual sexual contact. This percentage is a 9.8% increase over the course of 4 years. Sexual assault is an issue not to be pushed to the side. Some significant findings regarding sexual assault in college students involves individual and societal consequences that it brings. On the individual level, there is an increase in the likelihood that college students who experience a sexual violence will drop out of school. In a study conducted by Dr. Sharon Potter, 24% of participants in a survey indicated that they dropped out of their studies following the assault, and 67% indicated they experienced negative effects on their educational performance. Other individual-specific consequences include the development of mental health disorders such as depression, anxiety, and PTSD, physical damage, and social distrust. Moving on to societal consequences of sexual assault in college students, there is a recognized potential loss of intellectual contributions and economic contributions towards society. One could use the socio-ecological model to link individual consequences to society's consequences. This is through the idea that as an individual college student perform poorly or drop out of their studies, society may miss out on the opportunities that these individuals could have had. These opportunities may include population growth, reproductive health, competitiveness in scientific or medical advances, and so on. Society faces huge consequence in the loss of earning potential for each victim of sexual assault. Another helpful subtopic to know about is how individuals can prevent sexual assault. Some of the easiest ways to avoid a potential sexual assault situation includes always being aware of one's surroundings, having an accountability partner if you do decide to go out, paying close attention to your drink if you decide to consume alcohol, and to never leave it unattended, and to avoid going out alone at night. The following figure to the right of the slide lists other methods to preventing sexual violence and sexual assault, courtesy of the Centers of Disease Control. All of the methods in the figure can be linked toward promoting safer environments and well-being for college students. Other significant findings from my research include the barriers in reporting sexual assault among college students and responses to the reports. The most widely reported responses in many of the research studies for barriers to reporting a sexual assault among college students includes the fear of a lack of confidentiality, self-blame or guilt for the encounter even happening, fear of retaliation from the offender, knowing the offender, and the fear that others may not believe that the encounter even occurred or that the criteria of being a genuine sexual assault. When victims do decide to report their experiences, they may undergo a nurse examiner assessment exam, known as a SANE exam, to determine any health concerns. Universities are required to find solutions in fixing hostile educational environment as a response to the Title IX legislation. Based on the significant findings and research, there are public health implications that can be made. One implication is that sexual assault in college students is a health issue that directly and negatively affects individual lives as well as societal growth and development. This is supported by the U.S. Department of Health and Human Services, which provides statistical evidence of academic problems and mental health disorder development. Another public health implication is sexual assault in college students can be combated by implementing awareness programs that educate college students on primary preventative strategies and improving response systems. The following slide will present recommendations to facing these public health implications. I have included 2 recommendations that would be beneficial in improving health of college students. A practical method for public health would be the encouragement toward college students to be pro-social bystanders. Through sexual assault awareness and prevention programs, college students will learn how to act in situations that have the potential to become a sexual assault. Rather than allowing the bystander effect to take place, being a pro-social bystander is still optional, but it encourages students to help one another and prevent dangerous situations from escalating through safe and effective methods. A clinical recommendation is to develop a one-stop shop for sexual assault victims, rather than having to increase stress levels of receiving resources from multiple places. Having confidential caring environment that provides access to filling reports and receiving medical examinations specific to sexual assault would make seeking help much more encouraging. Especially for college students in their first year who may be unfamiliar with campus surroundings, that would be truly helpful. And thank you for taking the time to participate in this presentation. Together, we can all make a change in the public health of our college students.